This educational content is provided by Dr. Keshav Narain, a leading expert in retinal and optic nerve care at South Bay Retina. Have you ever noticed sudden sparkles, streaks of lightning, or camera flash bursts in your vision? It can feel strange, maybe even a little alarming. But what do these flashes actually mean? And why do eye doctors take them so seriously? Today we'll walk you through what happens during an eye exam for flashes, so you know exactly what to expect and why it matters for your vision. First things first, let's talk about something that might seem minor, but can actually be a sign of something serious: eye flashes. You might have noticed brief streaks or sparks of light in your vision, especially when you move your eyes quickly or in a dark room. But why do these flashes matter so much? When patients come in describing flashes, doctors pay close attention. That's because these flashes can sometimes be a warning sign that something is happening inside your eye that needs urgent care. It's not just about discomfort, it's about protecting your vision. Most of the time, flashes happen when the jelly-like substance inside your eye, called the vitreous, tugs on the retina. The vitreous is a clear gel that fills the space between your lens and retina, and as we age, it can shrink or change shape, pulling on the delicate retina at the back of your eye. Think of it like pulling on wallpaper. If you gently tug at the wallpaper, it might stretch a little or wrinkle, but it usually stays intact. This is similar to what happens in your eye most of the time. Minor tugs don't cause any real harm. A little tug might not do much, and in many cases, these flashes are harmless, and simply a part of the normal aging process. Doctors often just monitor the situation, especially if there are no other symptoms. But too much pulling could cause a tear in the retina, which is much more serious. A retinal tear can lead to vision loss if not treated quickly. That's why noticing and reporting new flashes is so important. It could save your sight. Now here's the tricky part. When it comes to flashes of light in your vision, it's not always easy to tell what's going on. These sudden bursts or flickers can be unsettling, and naturally, you might wonder if there's something to worry about, or just a harmless quirk of getting older. Sometimes these flashes are completely harmless. As we age, the gel-like substance inside our eyes, the vitreous, begins to shrink and pull away from the retina. This is a normal part of aging, and for many people it causes occasional flashes that don't mean anything serious is happening. But here's the catch. Sometimes, those same flashes can be a warning sign. If the vitreous pulls too hard, it can actually tear the retina, or even cause it to detach. A retinal tear or detachment is a medical emergency that can threaten your vision if not treated quickly. That's why doctors don't just say, "Wait and see." They know that waiting could mean missing the chance to catch a serious problem early. Instead, they want to take action right away to make sure your eyes are safe. When you come in with flashes, your doctor will do a thorough eye exam, looking carefully at your retina to check for any signs of tears or detachment. This isn't just routine, it's a crucial step to protect your sight. So the real challenge for both you and your doctor is figuring out what's causing those flashes. Is it just the jelly inside your eye shifting around, or is there something more serious going on? Sometimes it's just the natural aging process, the vitreous jelly moving and tugging a little on the retina, which is usually harmless. But other times the retina could be in real danger, and that's why it's so important not to ignore these symptoms. That's where the eye exam comes in. It's the only way to know for sure, and to keep your vision safe for the future. Let's break down the step-by-step process of a modern eye exam for flashes. Step 1. Your doctor asks about your symptoms. When did the flashes start? Do you also see floaters? Any recent injury? These questions help narrow down what's going on. Step 2. A vision test, where you read letters on a chart. This sets a baseline for your eyesight. Step 3. Dilation. Special drops make your pupils bigger, kind of like opening a window into the back of your eye. You'll be a little blurry and sensitive to light for a few hours. So, bring sunglasses and maybe a driver. Step 4. Slit lamp exam. It's like a super-powered microscope that lets the doctor see the clear jelly inside your eye. They're looking for bleeding, inflammation, or any signs the vitreous has pulled away. Step 5. Dilated fundus exam. This is the big one. Using special lenses and lights, the doctor checks the retina, especially the edges, where tears love to hide. And if the view isn't clear, say there's bleeding, an ultrasound may be used. Yes, the same type used for babies, but for your eye. Sometimes the doctor may add high-tech imaging like OCT scans or fluorescein angiography, which map out tiny details of the retina and blood vessels. So why go through all this? Because a thorough exam can literally save your sight. Catching a retinal tear early often means a quick laser treatment in the office. But if it's missed, it can lead to detachment and major surgery. Most patients leave reassured knowing their flashes are harmless, and for those who do need treatment, acting fast makes a world of difference. Here's the bigger picture. Our bodies are constantly sending us signals, some subtle and some more obvious, to let us know when something isn't quite right. It's easy to overlook these signs in our busy lives, but paying attention to them can make a huge difference in our health and well-being. For example, flashes of light in your vision aren't just about your eyes. They can be your body's way of alerting you to a deeper issue. These flashes might seem harmless or easy to ignore, but they can sometimes signal a problem that needs immediate attention. That's why it's so important to listen to your body and take action early, even if the symptoms seem minor. By being proactive and seeking help when something feels off, you can prevent more serious health issues down the road. Think about it this way. Just like chest pain can be a warning sign for your heart, letting you know that you need to get checked for possible heart problems, flashes in your vision can be a warning sign for your retina. Don't ignore these signals. Your body is trying to protect you. Trust what you feel, and always reach out to a healthcare professional if you notice something unusual. And when communities understand this, fewer people lose vision needlessly. Awareness really is sight-saving. So, next time you, or someone you love, sees flashes of light, don't ignore it. A simple exam can give you peace of mind, or catch a problem early when it's easiest to fix. At South Bay Retina, Dr. Keshav Narain and his team specialize in protecting vision with the latest technology and compassionate care. Call us today or visit 𝗧𝗶𝗺𝗀 to schedule your exam. Because when it comes to vision, early action is everything.